start the talk. We'll be introducing her later during an ovation as well. So, Dr. Marina, if you can kindly start.
Thank you so much, Dr. Rakesh. Can you hear my voice well?
Yes.
Thank you. I'm going to share the screen, my slide. So first of all, I would like to thank the organizing committee of the LVA and Laryngology Summit 2021 for inviting me to give this talk on clinical applications of stroboscope and enhanced laryngeal imaging. So, this is the center where I work. It is University Kebangsaan Malaysia Medical Center in Kuala Lumpur, Malaysia. Hopefully after COVID, you may come and visit me here. The content of the lecture, some introduction on advanced laryngeal imaging, which include high resolution chromoendoscopy, or we call it enhanced imaging, video laryngostroboscopy. And some discussion on clinical applications, demonstration case studies, about 8 cases, followed by conclusion. Patients who come with voice disorders, they commonly have vocal fold lesions, which the diagnosis may range from a benign to cancerous lesion, and often present a diagnostic dilemma to differentiate. And the gold standard is to perform direct laryngoscopy, and whether incisional or excisional biopsy for histopathological examination. So there is a great deal of research that has been devoted to improve the quality of visual images, hence to improve the diagnostic capabilities of endoscopy. So one of the improvement that has been made is enhanced laryngeal imaging and inclusion of the stroboscopic light. So this enhanced vocal fold imaging is a new concept, which potentially may enhance the diagnosis of laryngeal pathology. So in the market now, which is broadly used or widely used, is narrowband imaging and eye scan. There are other brands like SPICE, autofluorescence, and so on. So this enhanced laryngeal imaging is a high resolution and digital chromoendoscopy, which are primarily available in 2 systems. The first system is called pre-process system, which is the principle in narrowband imaging, in which the white light wavelength is altered according to absorption of hemoglobin. So the one that have shorter wavelength will absorb or the hemoglobin or vessel in the superficial layer, whereas the green light, which has longer wavelength, will absorb hemoglobin in the subepithelium, which is deeper. Therefore, the images which enhance the mucosa and vessels look in green light or green appearance. Whereas another system is post-process system, which is used in eye scan. Instead of altering the wavelength, it modify the white light by increase the contrast. So therefore, the color is more natural. It's just a little bit more red than usual, and it enhances the vessels. So eye scan is an adjunct to the traditional white light, which is within the same processor that is white light as well as eye scan. And this technology is considered novel because it can be coupled with stroboscopy in real time, which I'm going to show in our cases in case discussions of this. Examination of the larynx can be done using 70-degree scope or flexible scope. Previously, the examination is predominantly used 70-degree scope. However, the current technology with flexible endoscopy and camera at the tip, we call it video endoscope, have some advantages, like it is more tolerable, more convenient for the patients, and we can advance the tip of endoscope to be as near as possible to the vocal fold for us to study the vascular pattern. So what is the importance of studying vascular pattern? It may help us in differentiating a benign, a pre-malignant and malignant lesion. So according to this publication or guidelines that have been proposed by the European Laryngological Society, the vascular changes can be divided into type 1, 2, 3, and 4. In which type 1 is basically presence in benign lesion, whereby the vessels are in longitudinal, ectatic, and dilated. Whereas 2, 3, and 4, we are talking about perpendicular vessels, which I'm going to show in this diagram. The perpendicular vessels, also known as intraepithelial papillary capillary loops or IPCL, which develop secondary to epithelial cancerogenetic stimulus. As you see in this diagram, when there is warty lesion, there is feeding vessel from the base. So this is called perpendicular vessel. In a precancerous lesion, for example, like this, the vessel has narrow angle turning point. So therefore, from the surface, we can see like two symmetric dots. And this is suggestive of a pre-malignant condition. If you look at this picture, a patient with leukoplakia on the vocal fold, and if we focus on the vascular pattern over here, we can see symmetric dots. And as the lesion become cancerous and become more warty, the vascular loops become more spiraling. Like shown in this picture, the vessel from the surface of the mass look spiral type, and this is called type 4 vessel. So what are the potential clinical applications of this enhanced imaging and stroboscopy? So number one, by looking at the mucosal changes and vascular pattern, it may help us to differentiate between benign and malignant lesions. And number two, we can probably differentiate between a malignant and pre-malignant lesion. And therefore, we can offer a diagnostic and therapeutic option at the same sitting without having the patient to undergo two general anesthesia, first for biopsy and second for surgery. Third, it helps us to map the surgical margin in a malignant tumor to detect recurrence, and potentially it may help us to detect any mucosal changes due to acid reflux, and it may help us in improving the inter and intra-observer reproducibility. So in this study, it has shown that by combining the video stroboscopy and the high resolution digital command endoscopy, in which in this study it used NBI, it shows that it is a useful complementary tool in evaluating early potential vocal fold malignancy. It enhances the diagnosis. And in this study, looking at the value of eye scan in diagnosing vocal cord leukoplakia, what is the histopathology, in 52 patients who presented with vocal fold white patches or leukoplakia, the study have shown that most cases of severe dysplasia, carcinoma in situ, and invasive carcinoma depict type 3 and type 4 vessels. So therefore, it may be a promising diagnostic tool in detecting laryngeal cancer. So now I'm going to move on a case demonstration. The first case, I want to show how using this technology can help us identifying the lesion is inflammatory lesion rather than a malignant or pre-malignant lesion. So this is a young woman who is a non-smoker, complained of hoarseness for 2 months. And the endoscopic findings, we can see that there is some irregular mucosa of the whole of right vocal fold. And when we turn on the eye scan, we can see that the irregular mucosa become more apparent. This is on eye scan 2. And then we move on, turning on the eye scan 3. And when we do switch on the stroboscopic light, we can appreciate that there is absence of mucosal wave, and we don't see any perpendicular type of vascular pattern. So therefore, we think that this is inflammatory rather than malignant lesion. Plus, the patient do not have risk factor for malignant lesion. And this patient is put up for endolaryngeal microsurgery. And we plan for incisional biopsy instead of excisional biopsy so that we can send the specimen for histopathological examination as well as tuberculosis test, because tuberculosis is quite endemic in this country. This is the appearance of the lesion under general anesthesia. And we have performed precision technique biopsying or doing incisional biopsy, preserving the vocal fold ligament. The gene expert is reported as positive for Mycobacterium tuberculosis, meaning the DNA of tuberculosis was detected. And hence the patient was started on anti-tuberculosis. This is the endoscopic findings of the patient 1 month after anti-tuberculosis. The irregular mucosa has reduced. And on eye scan, we can see that the lesion become thinner, although there is some erythema. And on a stroboscopic examination, we can appreciate that there is returning of mucosal wave. So we know that we are on the right track, and the patient continued to improve and completed the anti-tuberculosis. The next case, a patient with vocal fold lesion. How this technology helped us in diagnosing benign lesion. There's a patient, a 40-year-old male who is a chronic smoker and use his voice a lot. He's a contractor. And we see he has a mass on the left vocal fold with some probably hyperkeratosis, so there's white patches, and the opposite vocal fold also there is some leukoplakia patch or whitish patch. So if we go back, we may think that this is malignancy, being a male and a chronic smoker. And we look at the guideline that is published for type 1 vascular pattern. It is longitudinal, tortuous, and dilated. And when we look back at this patient, this mass or this lesion shows a type 1 vascular pattern. So therefore, with some area of hyperkeratosis and possibly opposite reactive lesion. So a preoperative diagnosis of telangiectatic polyp was done, and the patient was put up for endolaryngeal microsurgery and excision of polyp with precision technique. This is the appearance of the mass under general anesthesia, and that is with dissection under microscope, and that is the end of surgery. And at 5 months post endolaryngeal microsurgery, there is no lesion seen on the left vocal fold, and this is on eye scan. We can see probably some scar over there possible. This is on eye scan 3, and when we turn on the stroboscopic light, we can appreciate the patient has, we have preserved the patient's mucosal wave. And although there is some reduced amplitude on the left side. However, in patients who have thick white patch or hyperkeratosis, the hyperkeratosis may obscure the vascular pattern, like in this patient. This patient, a male who is a chronic smoker, that is mass at the anterior commissure with possibly thick hyperkeratosis, as seen like whitish patch, does obscure the vascular pattern. However, when we turn on the stroboscopic light, we can appreciate that the vocal fold can adduct and there is generation of mucosal wave, and the mass kind of pedunculated and goes up, flop up. So the diagnosis is telangiectatic polyp and confirmed by histopathological examination. Then we move on to case number 4, how this technology helped us in offering diagnostic and therapeutic option in precancerous lesion. This patient who is a male, ex-chronic smoker, complaint of hoarseness. One important thing in when we want to examine near to the vocal fold, we have to give adequate upper airway anesthesia by giving laryngeal gargle, and we advance the scope as near as possible to the vocal cord and change the light from white light into eye scan. And we can appreciate that within this whitish lesion, there is perpendicular type of vessel, symmetric dots, possibly type 3 vessel. And when we turn on the stroboscopic light, we can appreciate this patch has reduced vibration. Like so, yeah, it has reduced vibration. So we suspect that this is a pre-malignant lesion, and the stroboscopic light can be coupled in real time with the eye scan. So this patient had undergone same sitting transoral laser microsurgery, and okay, there is some voice somewhere. Okay, and type 1 excision chordectomy, and the HPE confirmed to be high-grade dysplasia, which is a pre-malignant lesion. Another case, which is a patient with malignant vocal fold lesion, and how we can diagnose that pre-operatively. This is another patient, a chronic smoker male. We give adequate upper anesthesia and then advance the endoscope as near as possible. This is on white light as the endoscope near the vocal fold, and we change to eye scan. We can appreciate type 4 vessel. There's worm-like pattern, bizarre looking vessel. And when we turn on stroboscopic light together with eye scan, we can appreciate that the whole length of the vocal fold that is reduced, or there's no vibration at all. So with this, this is side to side picture on white light, and this is on eye scan. How does this technology enhance the vessels? And this is on montage. We can zoom the vessel pattern. So this is type 4 vessel, and hence this patient was offered diagnostic and therapeutic. We didn't have the biopsy, and under GI anesthesia, the mass spared the anterior commissure. Thus, we had performed type A CO2 laser chordectomy at the same sitting, diagnostic and therapeutic, and the HPE confirmed squamous cell carcinoma. And the patient to date, already more than 12 months, has been tumor-free. I just have the endoscopic view.
You're running out of bit of time. If you can just...
Okay. Sure. Okay. And so this is 1 month post-op. There is some granuloma at the anterior commissure. And we didn't biopsy this because we suspect this is granuloma based on the examination. So I think because of we start a little bit late and we don't have time, so I'm going to skip this slides. I just want to show this mapping of surgical margin in laryngeal carcinoma. So this is a patient who have been biopsied and confirmed squamous cell carcinoma. So with this technology, we can map the tumor, whereby we can see that the subglottic region, there is small lesion, and supraglottically we can see abnormal vascular pattern. And on the video stroboscopy, we noticed that the superior part has involved with tumor. So therefore, the patient had undergone type 6 chordectomy with special attention at the margin at the supraglottis as well as subglottis. So this is 3 months post-operatively and 4 months post-operatively. The granuloma has reducing, and so far there is no signs of tumor, residual tumor. I'm going to skip this slide. I don't have time, right?
Yes, please.
Yeah, I have to skip this slide. I'm going to go to the conclusion. So, okay. In conclusion, video endoscopy with image enhancement technology is useful in detecting subtle mucosal lesion as well as vascular patterns in vocal fold mass. So the examination of vascular patterns could significantly related to precancerous or cancerous pathology. By combining the enhanced imaging technology and stroboscopy, it is useful complementary tools in evaluating the extension and depth of tumor involvement. And it is also a useful tool in detecting early recurrence. So with that, thank you so much. These are my references. Thank you very much for your kind attention.
Thank you very much, Dr. Marina. That was very educative, and I must appreciate the crystal clear videos and the way you've explained the various vascular patterns